Okay, good to go.
Can we just get your name and title, please, to start?
Patrick Lawrence, I'm the CEO of First Step.
Great. What's your reaction to today's announcement that they're waiting for
Very, very sad. That's probably the overwhelming emotion. The action plan, every item on that action plan is fantastic, and there's this key element that we've been arguing for so long. I'd like to sort of contextualise it just a little bit. So they're proposing a health hub with GPs and others, whether that's Flinders Street or Burke Street, I'm not exactly sure. And I'll tell you what will probably happen there. And 95% of it will be fantastic. You'll have people who use drugs, people with co-occurring needs, including drug use. And they'll go there and they might have drugs in their bag. It's probably going to be a needle and syringe program, so they can have the paraphernalia, they can get clean needles and syringes, they can get advice from doctors about the health of their veins and how to minimise harm. And the one moment when their lives are at greatest risk, now I'm not saying doctors are going to do that blindly, but that's the fact. That's the one thing they won't be able to do there. So what's going to happen is that hopefully people will go to these centres, yeah? And if they do, they'll get all that support I just mentioned. And then they'll go out into the streets of the CBD and inject drugs. And who is that a good outcome for? It's not a good outcome for the government. It's certainly not a good outcome for them. It's not a good outcome for the shop owners or residents of the CBD. I've been to the King's Cross injecting room and North Richmond many times, particularly King's Cross. You wouldn't know it was there. You would not know. There's a sign on the door, Uniting Care, I think it is. People wander in, there's a room at the back where they chill out, and then they go back in the community. The CBD right over there is full of thousands of injecting rooms and injecting laneways and injecting streets where people are injecting unknown substances unsupervised. And our suggestion is that there be one, the community, that there be one with 4 walls and a ceiling and doctors and nurses inside. It's not a problem that's being proposed, it's a solution to a problem. And the other key factor that we lose sight of in all of this is 2 things can be true at the same time. Yes, addiction can come into anyone's lives. It could happen to my children, it could happen to, there are probably people standing here right now, cameramen, journalists, myself perhaps, who've had significant mental health, mental distress, traumas in their lives. But we know that there are particular people who've had a really tough life who are most affected by this issue. Specifically, people who grew up in out-of-home care, Indigenous Australians, and adult survivors of childhood sexual abuse. The overarching framework here we're talking about is poverty. And the people who use those injecting rooms fit in most of those categories. And I know from Dr. Nico Clark, who's the clinical director at First Step and was the medical director in North Richmond for 5 years, that nearly all of them want to stop using it. And that's where they can go to not be judged and receive all sorts of health advice, including you might like to try the various pharmacotherapy initiatives, all important, that the Minister was just talking about. And that's where you get to people. That's the intersection between this extraordinary way of saving lives, which is to non-judgmentally say, come in here, you'll be safe, we'll look after you. And then there's this other stuff that you might like to consider. And North Richmond was extremely successful at that. So it is a wasted opportunity. Again, I applaud all the initiatives on that action plan. All brilliant, one very sad exception. It's not really my place to comment on that, Benita. It's a sensible question, and I think I'll leave others to answer that question.
Some people call
That's
this
okay.
spineless, cowardly decision. How would you quantify this decision?
I would say I'm going to stick with sad. It will cost lives. I mean, there's absolutely no question it will cost lives. And there's absolutely no question that the action plan will save lives. So could we not please have done both? I get really frustrated because, of course, who wants a supervised injecting room next to their restaurant? Nobody. I get it, but if you saw one in action, and you saw how innocuous they are, how anodyne, how everyday and normal, someone goes and you wouldn't know what they were going in there for. So it is absolutely a missed opportunity. The Minister, with a question, responded that they're not considering sites anywhere else. So, my question there is, if the key issue is an inability to gain enough public support, what if we get enough public support somewhere? What if we get public support in St Kilda, or public support in Footscray, or Sunshine, or the growth corridors further out west of Werribee, further out southeast? Because It's not just a CBD issue, of course.
Do you think people who that's might not go to these services? Do you think will be those drug nurses that want to have any straight from the
Regrettably, that is absolutely so. Because the great benefit, and again I have this from Dr. Nico Clark, of North Richmond, is actually they save more lives with the other services offered. But it's that act really of love and of non-judgment that says, we care about you. We care about you and we see you as a human being, what Brendan Noddle was talking about. And what both the Minister and the Premier said, we're talking about real human beings. And when you say to a real human being, we value you, we care about you, we are not going to judge you, and we're going to help you through this journey. The previous Premier himself said that we need to keep people alive in order to help them get treatment. And the non-judgment of a supervised injecting room is exactly that. It's like an open door saying, come in here. No one's going to say you're doing anything wrong. No one's going to judge you. No one's going to send you away. No one's going to say, we don't do that here. They're just going to say, come in here, we'll look after you. And without the ability to do that as a health sector in the CBD, we're missing a massive, massive opportunity to work with literally the most vulnerable people in our community.
Do you think if Dan Andrews was still Premier, the second injecting room would be going ahead?
Absolutely not.
Thank you.
Thank you.
Thanks
Thank you.
for coming here.
Thanks, everyone.